Good morning, students. I hope you are all well. I'm Rabeea, teaching you this module that is the Nutritional Biochemistry for Exercise and Health. And today you are going to study the first introduction session of this module. And below here is my email ID through which you can contact me, any question, any confusion, what you want to ask to me, or if you want to contact to me online, you can book me on through this Calendly link. So you are most welcome. How much you want to be interacted with me for your guidance or anything else, any confusion. Now the housekeeping. If you have any question during my class on campus or any confusion, you are not understanding any topic or something, so you are most welcome. You can raise your hand, and when I will allow you, you can ask me the questions. Okay, and if you wish to ask me any question at the end of the session or separately from others, you can email me or can request me that after the session so I can guide you or can give you some more 30 minutes extra support session. And all the slides, documents related to my lecture and all related stuff that are related to these modules are available in Moodle. So please make a habit to open the Moodle daily, especially every week after taking my session. So it will help you to understand each topic very well, because this module is very, different from other modules that you have studied and you are studying. And this is not purely sociology. This is actually the biochemistry of the body, that what biochemical changes or normally is happening in the body. So please make a habit to read. After taking the session, go at home, download this PowerPoint document and read it and understand what it says and the other documents along with pre and post sessions as well. And in this module, we also have provided you the reading list, all learning resources related to the topics of your assessments in the Moodle, as well as in the handbook. So please also go through to them and understand them. Otherwise, it will be difficult to understand the questions of your exams as well, because it will be a test and then the case report. Now, objectives of today's session, and that at the end of the session, you will able to know that what assessments you are going to be doing in this module, and that's constituted of actually the two, the test and the case study report. And then you will get to know that what the term body composition is and what it stands for and why we use it for our normal physiology. After then, in the next part of this session one, we will going to be study what are the different methods to evaluate the body composition and the analysis of these methods, like the advantages and disadvantages of these methods. Now the lecture content, each session, each week, what you will be studying, that are provided in this PowerPoint, and you will have 12 sessions with me for this module. So first session is related to the assessment introduction, a little introduction, and second is the specific introduction to the module, covers other points as well as the metabolism of, iron, calcium, and that will be also covered in week 3. And furthermore, that are related to your part 1 of your assessment till week 5 and week 6. After then, around in week 6 or week 7, you will have an exam assessment for 30 minutes that you have to mark all questions, answers, or write this, SAQs, small answer questions, and that will be have the weightage of 25% for the marking of this module. After then, from the week 7 or 8, further lectures will be started with me that will be related to your content assessment, that is the case study report, in which you will study what activity and diseases are, and assessing the food intake and physical activity, followed by we get in non-pharmacological methods of treating hypertension. That means the high blood pressure and other topics lectures like the management of diabetes mellitus through non-pharmacological management and the preventive management conditions. After then, at the second last week, I will provide you the feedback about your assessments or any confusion you want to ask me. So I will provide you a separate extra some session for this as well. And please do remember that submit your assignments before the deadline, and so will be avoided any hindrance or anything net problem like this. So this table now, what it is showing that there are two components. Your actually assessment is, constitutes of the two parts. Number one is the class test, and second is the case study report. And what you are going to study in case study report, that is related to a clinical case, that is related to the hypertension. And then the learning outcomes, you have to write that are the 3 and 4. And for the class test, you have to cover learning outcomes 1 and 2. Okay, so what these 1 and 2, I will let you know. The weightage of this class test would be 25%, and the duration of this test examination would be 30 minutes. So what actually the learning outcome 1 and 2 would be covered in this class test, and it would be demonstrate an understanding of body composition, energy balance, and metabolic rate, explain interrelationships between selected micronutrients at the cellular level. So I think these all terms are very new for you, and I know you are not understanding, but you have the recording lectures as well. So when you are going to have studied all these other topics, after then see again this recording, go again to this week 1 session to get understand what it actually saying, that what you are going to cover. So in this learning outcome, you will study what actually our body is composed of. So this is the body composition and energy balance. That's how our body is maintaining the energy levels. Yeah. And then the metabolism rate, that is how our body is producing energy in our body. Then second learning outcome is that the interrelationship association between the selected micronutrients. Micronutrients are, for example, that are provided in every week session till week 5 and 6, and also will be covered by my lectures, such as vitamins, iron, calcium. So how this is a relationship at the cellular level in our body will be covered in your part 1 assessment test. For the case study report, that it will be constituted of 2,000 words, and the weightage of this assessment would be 75%. So please make sure your work will be accurate because it has greater weightage. Yeah. And the deadline will be let you know through email. And what the learning outcomes this assessment will cover, that would be 3, 4, and 5. So what these learning outcomes 3 and 4, 5 are: demonstrate the knowledge and understanding of the relationship between micronutrients, exercise, and health; demonstrate an understanding of the etiology of disease; evaluate the role of nutrition and exercise in prevention of disease. So still, I know you are not understanding, so don't worry. Just go through, understand, and after going through all these topics, again read them so that you can understand. And other thing you can do, that each week what we are teaching to you and what you are going to do, that open every week and understand all these documents and PowerPoints, lectures, all things, because they are all covering the related section that will be covered and will be, of course, can come in your test, part 1 of your assessment. Now I'm further explaining this. Okay. So in component 1 test, that would be of 30 minutes. So what it would become in the form of the multiple choice questions. Yeah. And these topics were covered your initial 5 to 6 weeks of this module. And what it mostly will cover, such as the principles of body composition assessments, what are the methods and their assessments, analysis of these methods, then energy balance in our body, metabolism rate, and that's, for example, basal metabolic rate in our body, how it means that how our body produce energy, how we consume then this energy. And then the association between the micronutrients like iron, calcium, and vitamins such as vitamin A, B6, vitamin B12 at cellular levels, what they are doing in our body. Now, next is the component 2, that is of the case study report, and how much words required for this assessment. It would be 2,000 words, and the weightage is high, that is the 75%, when we are calculating the whole module marks of your both assessments. So what you have to do in this component 2 of your assessment, that first you have to describe what actually the hypertension is. Hypertension means the high blood pressure. Yeah. And what you can do, because as it is a case study report, either at the first to last, it is better that first is to provide a case that is related to the hypertension, such as obesity associated hypertension or behavior of, so search for a case through a research article or an authentic site that is related to a hypertension high blood pressure case. Then describe it associated, and associated with your learning outcomes, and also link with this case as well. So after then, what you're going to do, you're describing what actually the high blood pressure hypertension is, and what are the conditions that causes hypertension, and conditions the cause especially by means of the biochemical changes and physiological changes in our body that are occurring. And for this, how you can elaborate in a good effective way, that first you are describing what actually are the normal and physiological rules, in our normal blood pressure, but when such biochemical physiological changes is occurring, so that we to be the hypertension. For example, by eating high fat junk diet, that will result into the fat deposition in our blood vessels, that results to the affected blood flow in our blood vessels towards the organ and the heart, thus it results to the high blood pressure. So this is actually the physiological reason, cause of hypertension. And what's the biochemical? You can discuss, for example, any type of the fat. Yeah, so good fats, bad fats, and linked with the hypertension. And we will all study all this, in further lectures after week 6 about these topics and other diseases. So with reference to the relevant authoritative guidelines, documents, research articles, and guidelines, because there are some health guidelines that are very important, okay, and are also available with some scientific literature that appraise the role of both diet and exercise role and their modification to manage hypertension. And in which type of hypertension they can be effective or not effective. Then explain what the key definitions, comparisons with the novel data that you already done, okay, relevant biochemical physical mechanism that is occurring normally and then pathologically towards the hypertension. After then, what you're going to do, you are writing showing some effects that are acute and chronic effects that are affecting through the dietary modification on the high blood pressure of person, and if adherence to these dietary modifications, what it would be in result, hypertension, or it will be helpful to relieve, reduce, or prevent the symptoms of hypertension, or it would be helpful to manage the symptoms of hypertension. Okay, for example, eating junk diet daily. So is it healthy? No, it can lead towards the hypertension. But eating the high fiber diet, healthy diet, and vegetables, and with good adherence on exercise, like in gym or 1 to 2 hours walk, that it will result to manage the symptoms. So which type of symptoms of hypertension? Yeah, and how you can provide all this information by searching through the relevant books that also have provided as learning resources in Moodle and the handbook, and also after our lectures in references. Yeah, so all things are found help in guidance from where you can, read and understand and put. And please do not forget to write, citations after putting all these informations and these learning outcomes of your assessments, and at the end references in LTU APS 7 style. So please do not forget, and also do not forget about the plagiarism. So please write in your own words. Do not copy and paste the same information, but at least plagiarize in your own words so it will not be plagiarized. After that, what you're going to do, you are explaining the key studies that have focused on the effect of dietary intake and exercise manipulation in hypertensive individuals. So what these studies are saying, that are these dietary modification exercises are helpful or not, for the hypertensive individual cases. Then you are providing some mechanism, reasoning. So why these dietary intake modifications or exercises, hypertensive individuals got well or not get well. So what happened after the adherence? Actually the reason why the adherence on this modified diet and exercise results in management of the system or reduction of the symptoms of hypertension. And at the end, then you will provide the practical recommendations to the individuals who have such conditions. But do not forget what actually the layout of the report is that you already had done in previous years as well, like the introduction, body, and conclusion. So I hope you will understand this. Now we are going towards this module, first topic, that is body composition. So what actually the body composition is? Body composition is the chemical or the physical components that collectively make up the organism's mass designed in a systematic way. So what actually these words are saying, that our body is composed of many compartments when we see macroscopically, that is physically. So what things are making our body? That are bone, our muscles, and fat. Yeah, so this of which our body are composed of. So in proper way, what we can say, muscles, fats, and bones, and other parts, where the fats are composed of the two essential fats and non-essential fats. So what essential fats are? Essential fats that are necessary for our body, for our survival, for our body maintenance. But non-essential fats are the extra fats that are stored in our body, and for example, due to what I say, stunning, sedentary lifestyle and eating a lot of fat food. So all the food is not consuming into energy, it is storing in the form of the fat in our body, that may result to obesity as well. So this is the thing that you have to understand. Yeah. And why this is important, body composition? Because can you tell me the difference? Is the body weight where we measure through the scale is the same, and this body composition measure is the same? No. Why? Because by the scale we just measure what our body weight is actually. Okay, but when we measure the body composition by different methods, what it shows that our body actually is composed of which contents. For example, athlete person have a high body weight, but it is due to his muscle mass and the bone. While another person have also the same high weight, but it is due to high percentage of fat in the body. So that is why it is important to know what actually the body composition normal is. Then we come to know the pathological is. And this picture is showing the normal percentage of the requirement of the body constituents in our body. So now, how we can study the components of our body composition that are divided into components: fat mass and fat-free mass. So what this stands for: fat mass, that's the body parts, the body stuff that are constitute of the fat making our body, and fat-free mass, those parts of our body that are not made up of fat but making the some weak composition of our body. And what they are: these are the water, proteins, and minerals. And now we are seeing more microscopically. Okay, and how we can calculate our total body mass? By making an equation. Total body mass plus equals to fat mass plus fat-free mass. What fat-free mass? Water plus protein plus minerals. And what parts of our body these things are making actually? Water, that is in the blood, proteins like muscles, minerals that are composed of, our bone. So the models of the multi-components are also has been introduced as a 3-component model and 4-component model. So we will discuss more in detail. Before that, I want to, show you this picture. What is actually this picture is doing? The measurement of body composition. So see and understand how the body composition evaluation has its own significance, because it shows that this person have a lot of body fat that is stored in the body, and it leads towards the risk of chronic diseases and poor health rather than a good lean body with good body composition. So this is the difference. Now we are going back to the components models. So these are the same, just to divide the solids. In 3 components, our body is divided into fats, water, and solids. But when split the solids into more minerals and proteins, then it will hold as 4-component model. Okay. So this is the picture that further elaborating that fat house. See, this is the accessories, non-essential fat. This picture is showing. Yeah, this is one of the component. So what actually the water component makes in our body, where it is composed, making the weightage of our body, it's made around in our body. We have around 70 to 80%, some books say 60% water in our body. Yeah. And our brain constitutes 73% of water, lungs constitute 83% of water, while blood carries the highest 95% water in a body. Yeah, and other lymphatic systems as well. And the bone is an example that is made up of many minerals like the phosphorus, calcium, magnesium, and the proteins that makes the muscle mass in our body. Now, what's next? You have to do that. What are the methods of body composition that can be assessed? Do you know any method which will be covered in next part now? So at the end of this session, now you know what the assessments you will have to do in this module. You have unpacked all first and second assessments requirements, and now you know what the term body composition is. Yeah, and now in next part, what you are going to do? You're going to study the different methods. Yeah, and the models to assess body composition. And here are the references of today's lecture. So any question, anything you want to ask, you are most welcome. Thank you.